first thing I'll do is check my order to see what procedure we're doing and just make sure I have all the equipment gathered. Then I will go into the patient's room and introduce myself. Hi, I'm Funta B. I'm a nursing student at Wichita State, and today we're just going to be inserting a Foley catheter to help with that urinary retention. And yeah, so first thing I'll provide privacy, then I would hand hygiene. Okay, can you please tell me your name and date of birth? Okay, good. Then I'll make sure the bed is at a good working height for me, which this is right now. And then, like I said, we'll just be doing the Foley cath to help with that urinary retention. Okay, next thing I will do, I will raise this up. I'll just hand hygiene again, and then I'll wear my gloves because we're about to cleanse the perineal area and just have access to that. So I'll just raise this up. Okay, so I just wear my clean gloves, and then do you need any assistance wiping all this? If you do, then I'll just help you out, but if you don't, I'll just walk you through it. So we'll just use soap and water, and we'll wipe the whole and washcloths. We'll wipe the vaginal area and your inner thighs. Just make sure that's all clean. Okay, and that's done now, so I'll put those away, and then I'll take off my gloves, toss them in the trash, and I'll hand hygiene again. So now the next thing we're going to do is the sterile portion of this, which is this. So I'll take this out. I'll just put this off to the side. I'll take the trash, put it on the floor. Sorry, in the trash, not on the floor, in the trash. And then I'll just make sure this is the right way I need it to be. Then I'll open this using that back part or the 1-inch margin. I'll open the side that's farthest away from me first, and then the other sides. Okay, and now that I have that done, I'll just make sure I have this sitting the right way that I need it to be. Using that 1-inch margin again, I'll just do that. Okay, then next thing I'll do, I'll take the sterile gloves out of there, and I'll just open it over here on this side. Again, I'll make sure this sterile field is above my waist, which is where it's supposed to be, and then I'll open this up. Okay. And make sure to put my gloves on using sterile technique. I'll just come off to the side here, and then I'm using those margins right there. Make sure it's open all the way. Okay. Then I'll put on my gloves. Making sure that they don't roll. And then I'll pick this up. Should be just a little bit hard because I didn't come on well, but it's okay. So I'll take this and make sure it's up high enough, and I will just okay. And then now I'll just adjust this now that I have that on. Then same thing, I'll toss this in the trash, and then Now I have my kit out, and I'll just make sure that my kit is good, and I've inspected the kit. Then I will separate that, and then I'll take this out here and put that underneath the patient, making sure not to touch the patient or the bed or anything that will cause me to be unsterile. And I'll take this and use this to cover that vaginal area right there. Okay, and that's good. Then I will come back to my kit, lubricate the tip of the catheter, and make sure to attach the solution to this end, the port. Okay, now that that's done, I'll open this up, make sure I have all my swabs ready. Okay, I'll just put them down, put this in the trash because it's easier that way for me. Okay, next thing I will do after I have all that set up, I'll use my non-dominant hand to make sure I hold the lips here open, okay, for good access. Then I will wipe the side of the inner labia that's closest to me, toss that in the trash. Now wipe the part that's farthest away from me, same thing, put that in the trash. And then I'll wipe down the middle, okay, and put that in the trash too. Then I will pick all this up and okay, just making sure not to contaminate anything. And I'll bring this over here, just drop all this down right there. And then I will take the tip and insert it into the vagina and keep going until I see some urinary output. And when I do, I go in 1 to 2 more inches, and then I inflate that balloon. Okay, so now that the balloon is inflated, I use my non-dominant hand to secure that, and I pull out this, and then I just give it a tug just to make sure it's inflated and secure. And then I will attach this to the inner thigh of the patient, and I take the bag, and this would not be there. I'll make sure my bag does not have any kinks like that, but just in case it did, we'll do that. And then I'll just attach this to the bedside railing right there where it can't move. Okay, and that's it. We're all done with that. Now, under normal circumstances, I'll peel that off and toss it in the trash, same with all this too, and cover up the patient. But right now I'm not going to stir that up because I have to put the kit back together. So after doing all that, I'll take off my gloves, and then I will cover up the patient and ask them how that was for them, if they tolerated it well, and they say they did. Okay, and then I'll just explain to them if there's any if they feel any pain or any discomfort, or if they see any blood in their urine, to let either me, the nurse, or anybody know as soon as possible. I'll give them their call light. This is the button that you push if you have any problems or any questions. And is there anything else that you need from me right now? No? Okay, good. So I'll make sure the bed is at the lowest possible height, and then I'll just hand hygiene, make sure to clear all this up, and we're all done. I'll leave the room, and once I'm out, I'll make sure to document the date and time of this procedure, the amount and color of the urine, the gauge of the cath that was used. This was a 14 French cc Foley cath. The I already said the amounts, about, let's say, 350 cc's, or the color of the urine was yellow. I'll put the amount of solution that was injected into the balloon, which was 10 cc's. The reason why we had the procedure done, which in this case was urinary retention for the patient, and if the patient tolerated it well, which, as they said, they did. And yeah, I believe that's everything I have for you. Thank you.